Yes, I just thank you for having me. My name is Sara King, and I'm the Community Health Education and Planning Lead for District 6 County Health Department. So that includes Cleveland, but also Grady, McLean, Potawatomi, Seminole, and Hughes counties. So I'm excited to be with you and answer any questions that I can. Right now, with the rate that we've been going, Oklahoma currently has ranked around 6th or 7th in the nation for percentage of vaccines distributed within populations. So to be 15 weeks in roughly, and to be kind of maintaining that level of distribution, we have heard from state epidemiologists like Dr. Aaron Wendelboe with the College of Public Health that if we remain on this trajectory and maintain mitigation efforts, we can reach what they call conditional herd immunity, which is essentially where you're combining the population that's vaccinated with the population who likely still has antibodies from a COVID-19 infection to really see a decline in COVID transmission. So on that, just kind of the reminder that I'm happy to answer any questions about any of the vaccines. We currently have Pfizer and Moderna that have been being distributed for since that December mark. Recently, the Johnson & Johnson, or what we call the Janssen vaccine, is now available in some capacities. That's a 1-dose shot compared to Pfizer and Moderna, which are 2 doses. And so this vaccine, though still in limited supply, Oklahoma only received about 30,000 of them within this last week, and those were distributed out to more rural areas where it's harder to catch clients to be able to get a second dose for other vaccines. The interesting part about the Johnson & Johnson vaccine is that it was actually still being monitored and tested through within areas where they've seen some of these other variants come up, like the UK variant, or some of those, to where it's also still shown to be pretty effective at preventing severe illness or death, including hospitalization. So that's really great news for this vaccine. I think especially being at a point where we have vaccines and they're being distributed, and we're seeing, especially in Oklahoma, a surprising number of people getting the vaccine. I think, we were not sure necessarily, we didn't know what to expect in terms of how interested people would be getting these vaccines, knowing that they're relatively new, but they're based on decades of science with other SARS vaccines and that type of thing. But the thing that I always want to highlight is, just because we have a vaccine, that's only one point of the puzzle. Still watching our distance and wearing our masks, particularly in spaces where we aren't sure if other people have been vaccinated, is still, in terms of, until we have just way more science to kind of fully understand the scope of what we're working with at this point in time with this specific virus, really still vital to protecting each other and protecting our communities. I can feel, and I'm sure other people can feel, kind of the light at the end of the tunnel, which is great. It's a huge relief for all of us, but it's still really important to make sure that we are keeping each other safe to the degree that we need to, especially as we kind of interact with people who still maybe are not vaccinated or maybe at risk of exposure or exposing other people.